Hey guys, it's Akayla Edwards here. So happy to see you back on A Special Life. If you're new, remember to subscribe and click on the bell so that you can be notified of future videos. You can also follow me on social media, which are linked below if you're interested. Also, a little side note, if you can see my shirt, it says #CleftMom, my favorite smiles are wide. I got this shirt in honor of Levi's Cleft Repair. If you're interested in this shirt, I can link it below. I just found it on Amazon for like 20 bucks. And it's like my favorite shirt ever. All right, so have you ever wondered how a cleft lip is repaired? In this video, I'm going to be going over some simple steps of the actual surgery and some other information about recovery and such. Several people before Levi's surgery asked me how they were going to repair it, and it's actually a lot more simple than you think. In most cases, cleft lip and palate babies actually have all that they need to get the repair. They don't need any kind of skin grafts or anything. All surgeons have to do is just connect the different pieces. There's the skin on the bottom of the lip, and then the tissue in the middle that they connect, and then the skin on top of that. And all they really do is just stretch it all together and then stitch it up. Obviously, every surgeon and hospital does things a little differently. At Primary Children's in Salt Lake, at the same time as the lip repair, they also put in place a prosthetic for the hard palate and then glue together the soft palate. A prosthesis is just a fake palate that they screw inside the baby's mouth just until they can have their palate repairs. If needed, they also place the ear tubes for this surgery. But not all cleft kids need ear tubes. At Primary Children's Hospital in Utah, they usually want to wait until they're at least 10 pounds to do the lip repair. In our case, that was when Levi was about 3 months old. Every hospital and surgeon is going to be different. Some wait until they're 10 months. It just kind of depends. So make sure you communicate with your surgeon and your cleft team to find out those details. If you're unsure of what items to bring to the hospital, I have a video that I can link up here, so go check that out, and that should make your hospital stay a little bit more bearable. Now, in preparation for the surgery, the baby will need to go without food for quite a few hours so that the anesthesia doesn't make them sick, which is a really hard thing for the babies because they don't understand why they can't eat and they're starving. So you'll want to bring a binky or other helpful items to keep them distracted before the surgery. Just be aware that your baby's lip will probably be really swollen from the surgery and have blood and stitches and things. Don't be too alarmed. Be really strong for your baby. The swelling does go down eventually and it'll clear up and look absolutely perfect once it's all healed up. In our case, Levi had dissolvable stitches, so we didn't even have to take him in to get the stitches taken out or anything. After just 2 weeks, most of the stitches were all gone and the swelling had gone down a lot and he just looked absolutely perfect. Kids are so resilient and can recover so quickly. After the surgery, the baby will probably be in arm restraints. A lot of hospitals provide them for you, but if not, there's a link below that you can buy some online. The arm restraints help to keep your child's arm locked in place so that they don't grab their stitches in their lip repair. You might not need to use the arm restraints for very long, maybe only a week. As long as I was holding Levi on my lap, I would give him a break and take the arm restraints off and just make sure I was holding his arms and not letting him touch his face. They really need to wear them at night, especially when you are asleep as well and can't keep an eye on them. But even during the day, if you can't hold them and watch them, they should be wearing some kind of arm restraint. Also, keep in mind that the baby will not be able to suck on a binky after the repair, so you can be really smart and wean them off before the surgery, or be like me and just give the binky back after a few weeks. It's the only thing that keeps Levi asleep. So I gave in and gave it back to him. Another thing to be aware of is that your baby will have no stents in their nostrils. After lip repair, the nostrils need a little help to keep the shape so that they don't collapse and cause breathing problems for your baby. The nose stents will probably be stitched in your baby's nose and will need to be worn for quite a few months after the repair until their surgeon gives the okay to take them out. Levi was on oxygen because of sleep apnea, so his surgeon just gave him a much bigger and thicker cannula to put in his nose that worked just as well as nose stents. Feeding is probably one of the biggest struggles after surgery. Some kids will refuse taking the bottle, and so you can use a syringe to try and feed them so that they don't have to actually gnaw and use their mouth to suck. In our case, Levi had a G-tube, so we only had to stay one night at the hospital as long as he was taking feeds okay without throwing up. Other kids have to stay 2 or 3 until the baby is feeling well enough and eating enough. The hospital stay isn't really too bad. They usually have some kind of a bed or pull-out couch that you can sleep on. Sometimes it's not very big though. If you have any questions, make sure you contact the nurses. They're usually really nice and really helpful. The most important part, especially for those first couple days after the surgery, you'll want to stay on top of your baby's pain medication. Levi was only 3 months old, so his surgeon didn't want him using Motrin or ibuprofen, so we would switch off using infant's Tylenol, and then just for a few days we used a tiny little dose of oxycodone. Again, that will depend on your hospital and the surgeon that you go through. But whatever medication you use, make sure you stay exactly on top of it so that your baby isn't miserable and you're not miserable. I would set an alarm every time he was due for pain medication, and then I just gave it to him immediately, and it helped so much. I know this is kind of a lot of information to take in and will probably make you a little bit more nervous for your child's surgery, having to think of all that your child will have to go through. And I get it. It's unfair that such a tiny, perfect little human has to go through such a hard thing. For me, the unknown is probably the scariest part. So knowing all these tiny little details made it a little bit easier for me to go through it. So I hope it's helped you a little bit too. If you have any other additional questions about the surgery or recovery or anything at all, put them in the comments and I'll get back to you as soon as I can. And if your child's lip surgery is coming really soon, good luck to you. I hope all goes well and the recovery is quick. Thanks so much for watching this video. Remember to give it a big thumbs up, and I hope to see you in the next one. Bye!